Some medical conditions sound too bizarre to be true, yet they exist and baffle even top doctors, from people who suddenly speak with new accents to those who feel detached from their own. Bodies, these rare disorders reveal how mysterious the human brain and body can truly be. Number 9. Foreign Accent Syndrome. Foreign Accent Syndrome, also known as FAS, is a rare speech disorder where a person suddenly starts speaking with a different accent after a stroke, brain injury, or neurological problem. Their pronunciation, rhythm, and tone change, making them sound like they're from another country. This happens when parts of the brain controlling speech and language are damaged. It doesn't mean the person actually learned a new accent. It's a neurological illusion caused by disrupted muscle, coordination, and speech patterns. While it might sound funny or fake, it can cause emotional distress and confusion for patients. Speech therapy can sometimes help them regain their original speaking style over time. Number 8. Alice in Wonderland Syndrome. Alice in Wonderland Syndrome, also known as AIWS, causes people to experience a warped perception of reality. They may feel that objects around them shrink or grow, or even that their own body parts change size. Some also report time moving unusually fast or slow. During an episode, people can feel disoriented and anxious, though it usually passes within minutes or hours. While there's no specific cure, treating underlying causes like migraines or infections can reduce the frequency of episodes. AIWS reminds us how fragile and fascinating human perception truly is. Number 7. Walking Corpse Syndrome. Cotard's delusion, also known as walking corpse syndrome, is an extremely rare mental disorder where people believe they are dead, rotting, or missing internal organs. Some even think they no longer exist. This condition is usually linked to severe depression, psychosis, or brain damage in areas controlling self-awareness. Patients may stop eating, bathing, or caring for themselves, convinced that nothing matters because they're dead. In some cases, electroconvulsive therapy has shown success. The disorder highlights how powerfully the brain can alter one's sense of reality, blurring the line between life and death within the human mind. Number 6. Exploding Head Syndrome. Exploding Head Syndrome, also known as EHS, is a harmless but frightening sleep disorder where people hear sudden loud noises such as explosions, gunshots, or crashes just as they're falling asleep or waking up. These sounds are not real. They come from the brain misfiring during the transition between sleep and wakefulness. Although EHS doesn't cause physical harm, it can lead to insomnia and anxiety. Doctors usually recommend stress management and better sleep habits to control it. Understanding EHS shows how, even during rest, the brain's electrical activity can create strange and unsettling illusions. Number 5. Stoneman Syndrome. Stoneman Syndrome, or fibrodysplasia, ossificans progressiva, also known as FOP, is one of the world's rarest genetic disorders, where soft tissues like muscles and tendons slowly turn into bone. Over time, this process can lock joints and make movement nearly impossible. Even a minor injury or injection can trigger new bone growth. The cause lies in a mutation of the ACVR1 gene, which misguides the body's repair process. There is no known cure, and surgeries often make it worse. Many patients rely on wheelchairs and need lifelong care. Scientists are researching gene therapies and medications to slow progression. Number 4. Alien Hand Syndrome. Alien Hand Syndrome, also known as AHS, is a fascinating neurological condition where a person's hand moves independently, performing actions without conscious control. The hand may grab objects, touch someone, or even act against the person's will. This disorder usually happens after brain surgery, stroke, or damage to the corpus callosum, the bridge connecting the two hemispheres of the brain. Essentially, one side of the brain sends signals the person isn't aware of. Patients often describe their limb as having a mind of its own. There's no complete cure, but behavioral therapy and physical exercises can help them regain some control. Number 3. Pica disorder. Pica disorder is a strange eating condition where people crave and consume non-food substances like chalk, dirt, soap, paper, or ice. It's most common in children, pregnant women, or people with nutritional deficiencies. Experts believe it's linked to iron or zinc deficiency, mental health issues, or developmental disorders. Diagnosing pica involves understanding both psychological and physical factors. Treatment includes nutritional therapy, counseling, and behavioral support to address the root cause. This disorder reminds us how closely nutrition, psychology, and behavior are connected in maintaining a healthy mind and body. Number 2. Werewolf syndrome. Werewolf syndrome, medically known as hypertrichosis, causes abnormal hair growth over the face and body. The hair can grow several inches long, giving people a wolf-like appearance. This rare condition can be genetic or caused by certain medications, hormonal imbalances, or tumors. Although it's not dangerous, it can cause social isolation and emotional distress. Laser treatments and hair removal methods offer temporary relief. Scientists believe it's linked to reactivated genes that were turned off during human evolution. Werewolf syndrome is a powerful example of how our genetic history still lies hidden within our DNA, occasionally revealing traits long thought to be gone. Number 01. Persistent genital arousal disorder. Persistent genital arousal disorder, also known as PGAD, is a rare and misunderstood condition causing constant or sudden physical arousal without sexual desire or stimulation. It can last for hours or even days, leading to pain, anxiety, and embarrassment. The cause isn't fully known, but experts believe it may involve nerve compression, hormonal changes, or blood flow problems in the pelvic region. Some cases are linked to antidepressant withdrawal or spinal nerve irritation. Treatment focuses on pain management, counseling, and medication to reduce discomfort. PGAD shows how complex and sensitive the nervous system can be, reminding us that not all physical sensations have emotional or sexual causes. Some are simply the body's misfired signals. The human body holds mysteries that science is still trying to decode. These strange conditions remind us how unpredictable life can be. Which one shocked you the most? Share your thoughts below, and don't forget to like, subscribe, and hit the bell for more mind-blowing stories like this.